If you've ever wondered if getting a hysterectomy will solve all of your incontinence problems, this video is for you. My name is Brittany Capiello, and I am a pelvic floor physical therapist. I've devoted my entire 21-year career to helping women just like you. So let's talk hysterectomies today, because this question comes up a lot. I have a lot of women who see their doctors, surgeons, and they recommend getting a hysterectomy to help with their bladder leaking issues, which makes very little sense to me because your uterus and your bladder are two different organs, and they don't really have a lot to do with each other other than the fact that they sit next to one another in the abdominal cavity. So if you go ahead and take a look at this diagram I did, I'm not an artist, but you'll get the idea. Here is your rectum, here is your uterus leading into the vagina, and then here is your bladder, which empties out of the urethra. You'll notice that the uterus sits on top of the bladder. So if you've ever been pregnant before and had to pee constantly, that's why. Sometimes after pregnancy, sometimes if you've just even never been pregnant but have suffered with constipation issues, or you do a lot of bearing down, holding your breath sort of activities, and your uterus can sometimes start to drop down into the vaginal canal. Now, that can disrupt the position of the bladder if it starts to drop down, or what can happen is if you have done a lot of bearing down, either during childbirth, long labors, long pushing, or if you've had a long history of constipation, your bladder might be starting to collapse down towards the vaginal canal as well. So sometimes when people leak, part of the issue is because they have a prolapse, which is when the bladder starts to collapse into the vaginal canal. For some reason, I have had a lot of doctors and a lot of patients come in who think if they take out the uterus, then the bladder issue will be solved. And I'm here to tell you today that unfortunately that is not the case, okay? Because what happens when you remove the uterus is that you now have a big open cavity between the rectum and the intestines and the bladder. And so what that means is now the bladder and the rectum have more room to move. So likely if you've had a mild bladder prolapse and a more significant uterine prolapse, you take the uterus out, now likely what will happen is your bladder will prolapse worse and symptoms may get worse, okay? So doing a hysterectomy to solve your bladder issues is not the answer. Strengthening your pelvic floor is definitely the answer. So what I will tell you is that when you suffer from a prolapse, it doesn't often, you don't strengthen your pelvic floor and it doesn't just go back into where it was, okay? But by strengthening the pelvic floor, you can eliminate symptoms, both of bladder symptoms and pelvic pressure that may come with that prolapse. And if you leave the organ in there, you have less likeliness for the bladder to collapse more, which would lead to more urinary issues. Same thing can happen with the rectum. If you take the uterus out, the rectum can prolapse more, leading to rectal issues, bowel incontinence, constipation problems. So hysterectomies are not the quick fix and not the answer that you're looking for when bladder issues is your main problem. Now, that said, I'm not against hysterectomies. I think that there are times and places where they are absolutely necessary. But make sure that you know the reason why you're getting a hysterectomy if you're talking with your doctor about one. And if the biggest issue is incontinence that you're trying to solve, check in with a pelvic floor physical therapist. Check us out at mycorefloor.com and let us help you. The option for surgery is always going to be there, is what I tell people. So why not try some of the conservative methods first, see if you can strengthen your pelvic floor, help the issues at hand by improving your pelvic floor strength and improving the support to all of these organs rather than just trying to take them out and find a quick solution. Hope that helps. Further questions, and if you want to learn more about prolapse issues or more about how you can stop your bladder incontinence issues, then check us out at mycorefloor.com.